This is a COVID-19 update recorded November 16th, 2021. I am Governor Dan McKee. Hello and good afternoon, Rhode Islanders. Thank you for attending today's press conference. I want to take the opportunity to discuss a few things about the vaccines and the boosters before the upcoming holidays, because Thanksgiving is just a week away. Family and friends will be getting together at this time. The first thing I would like to discuss is the booster. I would like to give you an update on a few points of information related to that. First of all, when the CDC approved the boosters back in September, we immediately made those available to the state of Rhode Island back in September, and we had a total of 105,000 Rhode Islanders who were fully vaccinated go to get those boosters. That's 105,000 people. That is equivalent to 24,000 people every week going to get those boosters. I am very happy with those numbers. I'd like to commend all of you on that. If we continue with that at 24,000 people for the next few weeks, that means that all the people in Rhode Island who have gotten those vaccines and gotten those boosters will be completely vaccinated with their boosters by the end of January. And the more people that are vaccinated and boosted, the more protection and more safe we will be. So I just want to thank all of you for your endeavor on keeping up with your vaccines and your boosters. And I'd like to take the opportunity to thank the Department of Health in Rhode Island. I'd like to thank the hospitals, the doctors, the schools, and all the pharmacies who have made this opportunity available to provide these boosters. I would like to thank you to continue this trend as we go forward. I also understand that 73% of the people who have already received their boosters were basically done at the local pharmacies, such as CVS, Walgreens, Walmart, or Stop and Shop. Those are the four major players. I can encourage you to continue to go to those facilities to get your shots. Now, there were other places that were also offering those shots, such as state hospitals and state facilities and community health centers. So you do have options on where you want to get your booster shot among that. Again, I want to thank each and every one of you. The second thing I want to talk about are the vaccines that are available for our youth in Rhode Island from the ages of 5 through 11. The CDC just approved back in November the 3rd, the vaccines for this category. And we have provided that, to all our youth here throughout the school districts and also many of the facilities. We have 80,000 youth in our state from the ages of 5 through 11 in the state of Rhode Island. 13% of that 80,000 is equivalent to a little over 10,000 children who have already been vaccinated with their first dose. Again, I want to tell you that I'm very pleased with those numbers. They're looking real good. And I ask you to continue in that trend to get your children vaccinated. Now, I know that some of you parents and some family members and guardians are still hesitant whether you should get a shot for your child or not. And I can understand that and respect that. But I want you to know that the vaccines are safe. They really do protect. Research has already proven it with scientific data. Pfizer, and the numbers around the world have all shown positive results as a result of this. So if you're hesitant, I can understand. But if you are, I encourage you to contact your school physician or the school nurses where your children go to school at before you make your final decision. Please get a consultation before you make your decision. I also understand that those of you who have made appointments for those vaccines for your youth, 60% have already been completed, which means 6 out of 10 children have gotten their vaccines, which means that there's another 4 students that haven't gotten those vaccines. We have about 40% of the vaccines still available, and I don't want to see those vaccines go to waste. So I encourage you parents and guardians to bring your children in after you get your consultation and get those vaccines. So continue to make your appointments. The last thing I want to discuss with you is that, as you all know, the numbers of COVID-19 positive rate has been spiking slightly for the last 4 to 6 weeks. And I have a little concern about that. And the Department of Health is also concerned about that, because we are now embarking upon the holiday season. We just came out of the Halloween holiday season. We have Thanksgiving coming up next week, which is going to be followed by Christmas and New Year's. Not to mention that the winter season is upon us, and that means more of us will be staying indoors. So as we stay indoors, we will feel that, COVID is over and we might feel safe, but I'm asking you to be mindful to use more precaution because we are going to be indoors. So I want you to know that those of you who are hosting these little family events, to communicate with your family and friends that are going to be attending your gatherings to find out whether they've received their vaccines or not. And those people who have not received those vaccines, encourage them to wear their mask and that they continue that so they can prevent the spread of this COVID-19. Okay, maintain your social distancing of 6 feet apart. And inside, even though you're indoors, continue to wear your mask, just as we have been previously. So really, the two things that really are going to reduce the numbers in possible contamination is vaccination and wearing the mask. So in the meantime, I wish you and your friends to have a wonderful holiday season. And Dr. Alexander-Scott is going to explain a little bit more about the spike and why we have those spikes occurring. Thank you. I'm Dr. Nicole Alexander-Scott. Good afternoon, everyone. Thank you, Governor. Thank you, Lieutenant Governor. I want to inform all of you that the positivity rate of cases that we have had in the last 4 to 6 weeks have spiked, which causes concern, as Governor McKee had mentioned. Right now, our positivity rate stands at 3.2%. That equates to 320 people that are positive out of every 100,000 people. 320 people are positive through testing out of 100,000 people. That number is high and is not good. Let me show you two different graphs that I would like to share with you right now. The first graph, as you can see, has an increase. And the second graph that I'm going to show you shows you the positivity rate. Okay, so the first graph, as I show this to you, take a good look. You can see that there's been an increase there. Now we are following the CDC guidelines in terms of the spread of the virus of COVID-19 with its numbers. The CDC regulations for every 100,000 people says that to be safe, they should have no more than 100, which equals 1.0%. 1% or less of the population is considered acceptable. Anything above that is considered too high. So right now, when we talk about 3.2% compared to last month when we had 1.6%, it's already doubled in 30 days. That is high. I would like to explain a little bit more about that so you can get a better understanding. The CDC has different tiers based upon a color code that they have initiated. The blue code is considered very low and is considered safe, between 0 and 9 people per 100,000 people. The second category is the yellow category, which is considered moderate. That is 10 to 49 people, which is still something to keep an eye on, but still considered safe. Now, the third category is substantial, which is orange, which means that it's reached its peak, which is borderline before becoming unacceptable. That is substantial. That is 50 to 99. Once you reach that 100 mark, anything above that is considered unsafe, which is the red circle. And if you're in the red category, things are not looking good. So these are the CDC guidelines that we are using. So let me show you the second graph so that you can get a better understanding of what I just mentioned to you. So as you can see between the two graphs, it means that we're really going to have to be a little more proactive in taking action and following the guidelines that are recommended. Okay, so we're going to double down on this now, which means that all of us need to work together and double down on this to keep the positivity cases from spreading further than what they are. Because right now we are 320 per 100,000. So we need to drop that number. Now, how can we do this? Really by taking 4 actions. This has always been the same thing as what we've always been speaking about previously. Nothing has changed. Continue to wear your mask, especially in congregate settings. Mask at all times. Follow the social distancing regulation of being 6 feet apart. Okay, 2 arm lengths apart for those of you who are not sure what 6 feet may look like. 2 arm lengths apart. The third thing in doubling down is to take advantage of the free testing that is taking place every 2 or 3 weeks now. So after you've gone to an event where you've been around a lot of people, go get tested to find out if you're contagious or not, or if you contracted or not. These tests are free. And the fourth one, which is the best of all 4 rules and guidelines of doubling down, is to go get vaccinated. So from here on out, let's keep this in mind, because the holidays season is now approaching us. We've just come out of Halloween. We've noticed a spike going on. Now we have Thanksgiving coming up, and then we have that followed by Christmas and then New Year's, you know, and also to take in consideration that this is now the winter season, and most of this impacts us from indoors when we are in confined areas. That's where the spread is more contagious, indoors. And as you know, the vaccines are available from our youth from the ages of 5 to 11. And it goes even beyond that, you know, up to 99 years of age. You have the 5 to 11 category, which is considered the youth. There are vaccines for them that have been approved. Teenagers between 12 and 17, the vaccines have been approved for them. And then the adults from 18 and above. So there are vaccines available for everyone from the ages of 5 to 99. Now, the research, as we look at it, shows that Pfizer, Moderna, and Johnson & Johnson, according to their reports, the scientific data shows, since they've been collecting this information for the last year, that the results are extremely good in terms of the people, you know, getting sick, testing positive, you know, getting blood clots or experiencing any, you know, side effects is less than 0.001, which is very rare. You will find someone who has a unique situation where they suffered a side effect or suffered some type of contraction after getting the shot. It is safe. Now, as we embark upon the winter season, the people that are at high risk are everyone who is above 65 years or older, or you are 18 with underlying medical conditions, or if you're in a category who is healthy, but you're in a high risk environment of employment, meaning like if you're a frontline worker where you're, you know, in a congregated area, or if you travel often among your work, or you're in a hospital setting or something like that, those are considered high risk environments. Okay, so with the holiday season in conjunction with the winter season coming up, you have a higher chance of contracting a positive. And unfortunately, those who have not been vaccinated, those numbers are expected to spread. So those of you who are at high risk, please keep your eye open, be aware of what's going on, mask up, protect yourself, make sure that other people are vaccinated as well, keep yourself safe. Another thing is that the flu season is among us now, and it started earlier this year. Normally, it starts around the month of October to around the month of February. That is the flu season, October through February. However, we are already 1 month into October, November, and the second month, and the flu vaccines, not the COVID-19 vaccines, I'm speaking about the flu shots. There have been more reported illnesses of people with the flu this year than last year. So the numbers have increased. So that is cause for concern, because early on, the flu has come early this year, and that is very unusual. And because the winter is not really here yet, and it's still warm temperatures, yet the flu did embark upon us very early. So now we have to deal with two different types of strains with the COVID-19 and two strains of the flu. So you got the flu, because they have two types of strains among the flu virus that's going on. Plus now with the COVID, we have the regular COVID-19 and the Delta variant. And so they're starting to mutate. So now we're dealing with these various strains. It can easily break out into another pandemic, and we don't want to see this happen. So I'm asking all of you, Rhode Islanders, please, please be more mindful. We know that the holidays are among us. You know, we're not enforcing any rules. We want you to do this on your own accord. Remember, last year, we were very new to this pandemic. We were unaware of a lot of things, and we had to set a lot of strict guidelines at that time, saying no gatherings, keeping the numbers very low. But this year, we don't have those enforced rules. We're a little bit more lax. We're hoping that all of you will become more conscious about what you need to do to prevent the spread of the positive cases that are embarking upon us every day. We want to see these numbers go down for the next 2 months. So we need to really buckle down and double down on this. If you're hosting a Thanksgiving dinner, that is great. It's fun to be with friends and family. But again, I'm encouraging, keep your gatherings small, not too large, keep them small. And I recommend that everyone that you have at your gathering be the ones that are vaccinated. Because if they're all vaccinated, you may not have to wear your mask, okay? But if you have family and friend members who come to those gatherings that are not vaccinated, you have to keep in mind that they should wear their mask, okay? And those of you may have to wear your mask as well, because of the fact, remember, there are people who are asymptomatic, meaning that people, don't have the symptoms of, COVID-19. They're feeling fine. They don't feel sick or anything like that. However, they are spreading it to other people. So, for example, about 2 weeks ago, there was one high school gathering. I believe it was Pilgrim High School, where they had the homecoming dance where people had gathered together. And for some reason, within the next 4 days, there was an increase of a population explosion of those that had occurred with COVID-19, because everybody was not on their guard. So keep in mind, please, the Department of Health is now tracking and trying to warn people to quarantine and stay home at these large gatherings, because from now on, the season is upon us where we are at higher risk. Thanksgiving is a wonderful holiday. It's a fantastic time of the year for friends and family to get together. And that is great. It's a fun time to spend together, and we encourage that. But be mindful and be aware that COVID-19 is still amongst us, okay, because of the Delta variant. And because of the fact that there are several people that have not gotten their vaccines as well, unfortunately. So we have to support each other and remind each other of what these regulations are, what we should do and what we shouldn't do, and to follow the social distancing guidelines that have been set up by the CDC. So nothing has changed when it comes to that regard. Do not let your guard down. This is not over. Thank you. And I want to wish each and every one of you a happy Thanksgiving. Remain safe and healthy and enjoy yourself. Thank you again. Bye-bye.